Bismillahirrahmanirrahim. Assalamu alaikum rahmatullahi barakatuh. I am Dr. Abdus Sattar Chowdhury from Awmc Medical College. My dear student, today my topic is function of glucocorticoids. Glucocorticoids having two functions. One is metabolic function, another is non-metabolic function. The glucocorticoid, source of glucocorticoid is the zona fasciculata, and a small portion is come from zona reticularis. Now I would like to discuss about the metabolic function of glucocorticoids. The principal hormone of glucocorticoid is cortisol. Its another name is hydrocortisol. Effects of cortisol on the carbohydrate metabolism, and it stimulates the gluconeogenesis. The rate of gluconeogenesis is increased by 6 to 10 fold, and also it causes decreased utilization of glucose by the cell. The mechanism of gluconeogenesis, that is, cortisol increase the enzyme required for the conversion of amino acid to glucose. In the liver, it increases, the enzyme increases. Also, glucocorticoid mobilize the amino acid from the extrahepatic tissue, that is from skeletal muscle. These amino acids is transported to liver, and liver increases the synthesis of glucose, that is called gluconeogenesis, as well as it increases the synthesis of glycogen, that is called glycogenesis. And these glycogen stored in the liver, and when the body needs glucose, it provides glucose to the plasma with the help of glycolytic hormone, that is glucagon, as well as epinephrine. Next is it decreases the utilization of glucose by the cell. The NADH is converted to NAD, that is oxidized form. That oxidized form of NAD causes glycolysis, and glucocorticoids inhibit this oxidation of NADH, therefore decrease the utilization of glucose by the cell. Glucocorticoid also raise the blood glucose level, and the mechanism of this increased blood glucose level is due to increased gluconeogenesis as well as decrease the sensitivity of insulin. These two factors contribute the blood glucose level increase. Second, effect of cortisol on the protein metabolism. Glucocorticoid increase the catabolism of protein and decrease the deposition of protein. Increase catabolism of protein and decrease deposition of protein or synthesis of protein. Glucocorticoid increase the mobilization of amino acid from extrahepatic tissue, skeletal muscle, and lymphoid tissue. These amino acid transported to liver, and also these glucocorticoid inhibit the RNA. When RNA is inhibited, there is no synthesis of protein. Sometimes excess of glucocorticoid, the skeletal muscle become very weak and difficult to erect from squatting position, and also it depresses the immune system of the body because it mobilizes the amino acid from the lymphoid tissue, and glucocorticoid increase the liver protein synthesis and increase the plasma protein synthesis in the liver. And in the liver, it causes increased rate of deamination of amino acid, increase protein synthesis in the liver, increase plasma protein synthesis in the liver, and increase gluconeogenesis in the liver. Third is glucocorticoids, effect of glucocorticoids on the fat metabolism. Glucocorticoid increase the mobilization of fatty acid from adipose tissue. That fatty acid immediately provide energy, and also it inhibit the uptake of glucose by adipose tissue, and also inhibit the deposition and synthesis of triglyceride in the adipose tissue. As you know, triglyceride is free fatty acid and glycerol. The glycerol portion is derived from glucose, and glucose cannot enter inside the adipose tissue. As a result, triglyceride will not be formed, will not be deposited. And also these hormones, glucocorticoid hormone, increase mobilization of fat from peripheral tissue, and that will deposited in the upper abdomen, chest, neck, and face. That gives a typical appearance of buffalo torso, that is called Cushing syndrome. These are the metabolic function of glucocorticoid. Now come to the non-metabolic function of glucocorticoid. First, I will give the headlines. What are the non-metabolic function? First is it is prevent the stress, it is the anti-stress hormone. It prevent the inflammation, it is anti-inflammatory hormone. It prevent the allergy, it is anti-allergic function. Then it is a permissive role. Glucocorticoid having permissive role. I will discuss this later on. Then glucocorticoid causes decreased secretion of ACTH. The effect of glucocorticoid on the nervous system, that is excess, and also glucocorticoid having role on blood vessels. Then effect of glucocorticoid on the water metabolism, effect of glucocorticoids on the blood cells and lymphoid tissue. First, I would like to discuss about the anti-stress or prevent the stress. What is stress? Stress can be defined of any change in the environment, or that change or threatens to change and constant steady environment, steady and optimal steady environment. Now I will give you some other stress. Surgical, before surgery there is a stress, infection stress, fever stress, then increased cold, decreased cold, also these are stress. During stress, any stress, there is increased secretion of glucocorticoid via the limbic system. These glucocorticoid secretion will be increased about 6 to 10 fold, and these glucocorticoids mobilize the fatty acid and amino acid that will provide immediate energy, and also the amino acid is converted to purine and pyrimidine base as well as creatine phosphate that maintain the cellular life and also helps to reproduce the new cell, and that new cell will repair the damaged cell that is due to the stress. Glucocorticoid having anti-inflammatory action, that it prevents the inflammation. What is inflammation? That is any type of damage, trauma, or by bacterial infection, there is a development of inflammation. Glucocorticoid can prevent the development of inflammation, or if any inflammation already developed, that will hasten the resolution and repair of the inflammation. The mechanism of glucocorticoid to prevent the inflammation: first, it stabilizes the lysosomal membrane. As when the lysosomal membrane will stabilize, there is no enzyme is related that will not damage the cell. Next is it prevents the permeability of the capillary, and glucocorticoid prevent the permeability of the capillary. These hormones also prevent the migration of macrophages and prevent the phagocytosis. And also glucocorticoid decrease the number of lymphocytes and size of lymphoid tissue, that it prevent the reaction between antigen and antibody reaction, and also by this process it prevent the inflammation. Glucocorticoid attenuate the fever, that is, it reduce the fever or decreasing the interleukin from the neutrophil, that is, it reduce the fever by inhibiting the secretion of interleukin from the neutrophil. Also, it prevent the leukotriene and prostaglandin that are responsible for inflammation. And once the inflammation has developed, it will hasten the resolution and repair of inflammation. Glucocorticoid increase mobilization of amino acid, and these amino acids is converted to purine and pyrimidine and creatine phosphate that will help to regenerate new cells, and new cells will repair the inflammation that already developed. Glucocorticoid acts as anti-allergic. Glucocorticoid also prevent the allergy, that is, glucocorticoid can be given in anaphylactic shock that will prevent the leaking of the membrane as well as leaking of the capillary, that will help to prevent the allergy. Glucocorticoid cannot alter the antigen and antibody reaction. Now the permissive rule, a small amount of glucocorticoid must be present to occur several metabolic functions. Although glucocorticoids do not produce these effects by themselves, this effect is called permissive rule. This effect is called permissive rule. That is, glucagon raise the blood glucose level by increase gluconeogenesis and glycogenolysis with the help of glucocorticoids. Similar, catecholamines, epinephrine and non-epinephrine, having calorogenic effect, lipolytic effect, and pressure effect. These effects cannot do alone by catecholamines. It needs a small amount of glucocorticoid. All these actions cannot do alone. Catecholamines and glucagon at least need a small amount of glucocorticoid. That is called permissive action. Now, glucocorticoid increase or decrease secretion of ACTH. When increase level of glucocorticoid, decrease secretion of ACTH. When decrease secretion of glucocorticoid, increase secretion of ACTH. Then vascular reactivity. In absence of glucocorticoid in the blood, smooth muscles of the blood vessel become unresponsive to epinephrine and non-epinephrine, and that is, it regains the vascular reactivity. How does it act? It acts by two ways, but it reduces the permeability of the capillary as well as it increases the sensitivity of epinephrine and non-epinephrine to small blood vessels. Now, effect of cortisol on the central nervous system or nervous system. It has been seen that decreased level of cortisol, the personality will be changed, the EEG wave will be changed, and subject will be irritable and cannot give attention to the study or anything, and this is apprehension. This effect on water metabolism, that is, lack of glucocorticoid the body will retain fluid in the inside, and that fluid causes water intoxication. And if you administer glucocorticoid, that GFR will be increased, that fluid will be removed from the body. And glucocorticoid having effect on blood cells and lymphoid tissue. Glucocorticoid increase the total number of RBC, total number of WBC, total number of platelet, and also increase the monocytes, and it decrease the eosinophil count, it decrease the basophil, circulating basophil, and also number of lymphocytes, and decrease the size of lymphoid tissue. It decrease the eosinophil by increased sequestration of eosinophil in the lung. In addition to this, glucocorticoid having some other function, that is, it decreases the secretion of growth hormone and inhibit growth. Also, it inhibits the secretion of thyroid stimulating hormone. Also, in later or third trimester of intrauterine life, it stimulates the maturation of surfactant. That surfactant, without that surfactant, the newborn baby may develop hyaline membrane disease or respiratory distress syndrome. I think it is enough. I have given so much information. It is enough for you, my dear student. Just try to see the book and read attentively at home. Thank you, sir. Okay.